Let me invite our second speaker. Cindy Walker is from Medtronic. She joined Medtronic in 1997 and brings a wide range of experience in effective leadership. Her current responsibilities include global medical education, fellowship programs, procedure training, Salesforce training, the grants and donations function, customer insight, and professional relations. So whole gamut of training. So she will be talking about how industry is responding to customers' needs in terms of healthcare workforce development. So come on. Thank you, Cindy.
Okay, so again, thank you, and thank you, Patricia, for inviting me to be here today. I think I'm coming at education a little bit different than everyone in the room. When we look at kind of the continuum, where industry plays is at the end, right? After they have, finished their fellowship. And now they're going to go out and they're going to do something else. And so the education that we're providing is very specialized. And in fact, a lot of physicians and a lot of allied health professionals don't ever get training in the area that my team develops education. So just a little bit about what my team does. We train our own employees. And to give you a sense, we're in the pacing business, so pacemakers, defibrillators, implantable cardiac rhythm devices. It takes anywhere from 9 to 18 months to train an employee. And we have employees all over the world. We train physicians, we train allied professionals, and again, they're not getting the type of training that we're providing in fellowship. So we're kind of adjunctive, I guess, to the fellowship. And then as we come out with new devices over time, obviously there's additional training opportunities from that perspective. So some of our challenges that we face, right, it's a huge world. In the US and in our developed markets, we have a lot of people out there providing education, doing kind of that traditional teacher-learner, mano-a-mano I call it, training on our products and therapies and how do we program them. In order to expand into emerging markets, what we quickly learned several years ago is that we are not going to be able to do it like we have been able to be funded in the developed markets. So the challenge is, how do we get into the other parts of the world? So just to give you a sense, in the US, we have about 1,600, or I like to say 3,200 feet on the street, going out and supporting implants, supporting physicians, supporting allied health professionals. In our largest opportunity countries like India, or continents like Africa, China, we have just a fraction of that. So how do we get out there and provide the education? Really, the only answer is technology. The other challenge that we have is that because you're not paying for the education necessarily, you're not going to college to get that degree, you're not going for a PhD, an MD, or whatever it might be, it's pretty much all voluntary. So we have to find ways to engage our learners around the world such that they are, by word of mouth, saying to the next person, oh, you need to go take that course. Not only was the content awesome, but it was a lot of fun to take. And you can all imagine that everyone is really, really busy. So they're not waking up in the morning thinking, gosh, I hope I had 15 minutes today so I can take a course. So what I'm going to talk about today is just two techniques using technology that we have embraced. We use a number of them that we talked about here today with video, live streaming broadcasts, and things like that. In fact, I heard a lot of comments about Africa just recently. Last week, we did live case broadcasts, completely interactive. We had about 50 physicians in East Africa interacting with 5 cameras in the room, providing instruction. And it is amazing the results that you can have from that perspective. So, 2 things I'm going to talk about. Hands-on simulation. We talked about simulation a number of times. We build simulators specifically to our procedures. We're going to talk about that a little bit. And then adding HoloLens. A little bit about augmented reality, virtual reality, AI. It's great if it actually works to teach the learner. Otherwise, it's a gimmick. And so what I would say to my counterparts at Medtronic is, well, if I can teach someone to do an implant or a procedure or whatever it might be as well as in person or in other means, the outcomes are the same, if not better, than our clinical study, then let's think about it. Otherwise, I send it over to marketing communications and tell them to put it in a booth, right? So it really needs to be a tool, if we're going to make the investment, that actually is going to engage and teach people. So it seems pretty basic, probably to everybody in this room, but when you're in the halls of a major device manufacturer that loves cool things, that's sometimes a hard battle. And then we're going to talk about interactive video. Augmented reality. Just a couple definitions. You guys can take a look at that. In the meantime, I'm going to pass this around, and I think I might have broken this little number. Here's what my challenge was. Everybody's familiar with the traditional pacemaker, right, that you implant? This here, if you can see it, is a leadless pacemaker, implanted through the groin. Brand new procedure. How are we going to teach physicians all over the world? I'm going to pass this around because it's kind of fun. Oops. Okay. Yeah, I wasn't able to get this thing hooked on. Okay, so go ahead and take a look at that. What we decided to do was build a simulator. We work with a company up in Montreal called CAE. Many of you have probably heard of them. They do a lot in the aviation industry. They work with defense departments with countries around the world. And they have a small group for medical simulation. So we went up there, we built a simulator specifically for implanting this particular procedure. We also built online modules. So again, as we've talked about, blended learning modules. What we want to do with physicians when we're trying to train them on a procedure is really take advantage of the little time and attention that we have from them. So online learning modules where they can learn about the procedure, and they can learn how the delivery system works. You can see right here the delivery system, lots of little gadgets and knobs and things like that. So we can teach that in a online learning management system. And then they come in and then they work on a simulator. What you're looking at here then is the augmented reality heart, right? I personally like AR better than VR because I can see what's around me, right? I get a little motion sick with the other. So what the physicians are able to do is have a 3D image in front of them to see where they need to go in the heart to place the device in a very safe manner. When we show physicians this, they line up to get on it. It's amazing. And again, it's beyond a gimmick. And I say to them, well, what did you think? And I want them to say, yeah, I can learn the procedure faster, more efficient, same clinical outcomes as what we had in the clinical study, right? Or better. They skip right beyond that. They say, oh my gosh, if you could do this procedure, I think I could take 6 months off of fellowship training. And so we think about how we can continue to engage and get physicians around the world. And this, by the way, this simulator that we put together is portable. It weighs 49 pounds, can go in the back of your car, can go on an airplane in the overhead bin, all that kind of good stuff. We have about 80 of them around the country. This is kind of what they'll see. So over here is a rendering of fluoro on the simulator, and then the 3D image sitting in front of that. Wish I had it here with you. Anyway, so we do use it for marketing. I will tell you, the number of marketing communications folks are like, you have to bring your simulator. And then what's even more fantastic, this is when you know you've really engaged your customer, when they're asking you to bring your training and education tool to their event to further train. Okay, so lots of possibilities. This is an example, and again, opportunity to train more than one physician at a time. Talked a little bit yesterday about simulation, and it's kind of one person goes through the simulation of whatever it is, whatever the procedure or you're trying to do. What we're able to do with this is have multiple, up to 12 learners at one time, and they're all seeing the same procedure interoperatively. Okay? So engagement. A number of these are Medtronic employees. About 8 of them are physicians at this particular one. So 12 HoloLens at one time. Okay? So that gives you a sense for why would you make the investment? It's a pretty big investment to build a simulator for a procedure. It's a pretty big investment to do HoloLens and have it customized to that particular procedure. And again, it can't be generic. If it's generic, really what did they learn about that particular product and that procedure and what it feels like in a human patient? Okay. So moving along. The second topic that I wanted to talk about was interactive video. So there's lots of videos out there. We all probably have learning management systems that we've either put together ourselves or you have participated in. And if you are like me, maybe not because you're probably all better educators or students than I am, when somebody pushes a training out to me and it's a video, I tend to let it play and then hope it gets to the end. Is anybody else like that besides me? Okay, so that really isn't going to teach the learner. So we have to employ, right, different, whether it be a gimmick or whatever it might be, in order to get the learner to stop and listen and actually absorb what we're trying to teach them. So a couple of the things. This is a slide from Deloitte that I particularly like, and if you take a look, 1% of the typical work week is all that employees have to focus on training and development. That really applies to my world. They are busy. They are not waking up in the morning saying, oh, please send me another training module, right? So I have to find a way to get them engaged every single day. They're impatient. They've got a lot of things coming at them. They're looking at different videos. I'm going to show you a slide here on the volume of videos that people are taking a look at. So how does your video make a difference in their life to actually teach them something? This particular slide, and I love to show this actually to our field because it really is reminiscent of the brain of a sales rep, of a physician, of an allied professional. They're very impatient. Just get to the point, right? They want visual, whoops, sorry about that, visual, go that way, and social, and collaborate, right? So just a couple statistics on video. I'll let you take a look at that. People are watching lots and lots of video. Some of it is good content, some of it is not. I think that's one of all of our challenges, right? There's lots and lots of video out there. The social aspect of things is really good, but how do we make sure that what they actually are absorbing is qualified content that actually is accurate, right? All right. So again, why make the shift? That's where people are. But the challenge is how do we get them to pay attention? Choices. Give them choices. How do they want to learn? It doesn't always have to be one way. Different things appeal to different people. This is a technique that we've employed that people love. They can kind of work through the room here, find out what they need to know, and move on. Yep. Again, more choices, lots of opportunities, downloads. Again, they're having to click, they're having to pay attention. It's not just running. So all these little techniques to get the person to pay attention. Give them a menu of choices. That way they can really focus on the areas that they need to focus on. Quizzes. This is an actual device. This is one of our highest service burden items. It's one of our simplest pacemakers. It's an external pacemaker. Every hospital all over the world, we have to train everybody. And so traditionally what people do is they go in and they do all 3 shifts. And then if somebody missed it, then they have to go back. It's a huge, huge service burden, and then people forget because they're impatient, right, and they've got other things to do. So we've really standardized the training globally on this, and the learner can come in and pick and choose whatever they need to do. Again, interactive videos. This is actually a video part of the training where they put their hands on it and they have to learn it, and it's all online, right? So kind of that self-paced and nice references as well. Talked just a minute ago about quizzes. Quizzes are very important, giving that immediate feedback. And again, that helps the learner know whether or not they actually learned something, during it. And whether or not you keep track of how someone performed, that's up to you. Sometimes it's not that important for me to know how everybody scored. What's important to know is that they actually understand the content, they're able to put it into play, and they know where to go for a reference 24/7 anywhere in the world. And they found it engaging and educational. Okay? Again, interactive video, I think probably everybody in the room knows that when you are forcing them to do things versus just letting the video play, that their retention is much better. And there's some statistics on that. Okay? And I'll wrap up there, just looking at the clock here. So any questions? I think we're going to go to the table. So again, we are a big fan of the new technology, but just to close it out, it can't be technology for technology's sake. You have to be able to prove that it actually has staying power. So thank you.